Get out of here, the nurse shouted. The nurse looked at Clint Eastwood sitting in the emergency room waiting area and said, loud enough for other patients to hear, "Sir, I'm going to need you to leave. We have real emergencies to deal with, and you're taking up space that younger patients might need. At your age, there's only so much we can do anyway." Clint was 94 years old. He'd been sitting there for 40 minutes. He hadn't complained, hadn't demanded special treatment, hadn't even mentioned who he was. He was just an old man waiting his turn like everyone else. But to this nurse, Nurse Jennifer Carson, according to her name tag, he was wasting resources, taking up space, too old to be worth the trouble. "I'm not here for myself," Clint said quietly. "I'm here with not—" "I don't care who you're here with," she interrupted. "Hospital policy is to prioritize patients with the best chance of meaningful recovery. At 94, that's not you. So please leave before I have to call security." What happened in the next 5 minutes would end her career, expose a pattern of elder abuse she'd been getting away with for years, and change hospital policy not just at that facility but across the entire state. This is the story of how a nurse's age discrimination backfired in the worst way possible, and how Clint Eastwood's response protected every elderly patient who came after him. To understand why Clint was at that hospital, you need to know what had happened 3 hours earlier. 3 hours before the confrontation, Clint Eastwood had been at home in Carmel. It was a Tuesday afternoon, quiet, ordinary. He was reading in his study when his phone rang. It was Sarah, his daughter, the one he'd been with on that Christmas Eve 40 years ago when his father died. She was 53 now, and she was calling from the hospital. She'd been in a car accident. Nothing catastrophic, but she'd hit her head, was dizzy, possibly concussed. The paramedics had insisted she go to the emergency room. Her husband was out of town on business. Her kids were at school. She'd called her father because she needed someone there, someone to make sure she was okay, someone who wouldn't leave until they were certain she was fine. Clint had driven immediately to the hospital, arrived within 20 minutes, found Sarah in the waiting area, looking pale and holding an ice pack to her forehead. She smiled when she saw him. "Thanks for coming, Dad. I know you hate hospitals." He did hate hospitals, ever since that Christmas Eve, ever since arriving 13 minutes too late. But this was his daughter, and she needed him. So he sat beside her, held her hand, and waited with her to be seen. That's when Nurse Carson had appeared, had looked at the elderly man taking up a chair in the waiting room, had made an assumption, and had decided to do something about it. What Nurse Carson didn't know was that she'd done this before, many times before. Later investigation would reveal that Jennifer Carson had been employed at Mercy General Hospital for 12 years, and for at least the last 5 of those years she'd been systematically mistreating elderly patients, not in obvious ways, not in ways that left physical marks or triggered immediate complaints, but in ways that were insidious, dismissive, cruel, and their casual cruelty. She'd tell elderly patients in pain that they needed to toughen up because at your age everything hurts. She'd delay responding to call buttons from older patients saying they were always calling for nothing. She'd talk over them to their younger family members as if the patients themselves weren't capable of understanding their own medical situations. She'd pushed for DNR orders on elderly patients whose families hadn't requested them. She'd advocated for comfort care only approaches for seniors who wanted aggressive treatment. She'd told more than one elderly patient that they were too old for certain procedures, even when doctors hadn't made that determination. And she'd gotten away with it because elderly patients often don't complain, don't want to be seen as difficult, don't trust that anyone will believe them over a medical professional. And because their families, when they did raise concerns, were often dismissed as being overprotective or not understanding medical realities. But on this particular Tuesday afternoon, Jennifer Carson made a critical error. She targeted the wrong old man. When Clint tried to explain he was there with his daughter, Carson's response got worse. "Your daughter's 53 years old," Nurse Carson said, glancing at Sarah's chart. "She doesn't need her elderly father taking up space in the waiting room. She can handle this herself. And frankly, at your age, you're a liability. What if you fall? What if you have a medical emergency while you're here? We're already stretched thin without dealing with—" She caught herself, but not before the implication hung in the air. "Without dealing with old people who should probably just stay home." Sarah, despite her concussion and dizziness, stood up. "Excuse me? You're telling my father to leave?" He drove here because I called him, because I needed him. And you're treating him like he's some kind of burden? Ma'am, please sit down. You have a head injury. Carson's tone was condescending. I'm trying to manage limited resources and having non-patients taking up chairs that actual patients might need. He's not taking up a chair some patient needs, Sarah said, her voice rising. He's here supporting his daughter, which is what family does. And the way you're talking to him about him, like he's disposable just because he's 94. I'm doing my job, Carson snapped. And part of my job is making sure this waiting room functions efficiently. Now, sir, I'm going to ask you one more time. Please leave, or I'll call security. Other people in the waiting room were watching now. An elderly woman with her adult son, a middle-aged couple, a young mother with a toddler. They'd all heard it, all seen how this nurse treated a 94-year-old man whose only crime was being old and present. Clint stood slowly, not to leave, but to speak. Before you call security, he said calmly, you might want to call your supervisor instead. Carson made the call, but not to her supervisor. Jennifer Carson pulled out her radio, called for security. 2 guards arrived within minutes. She explained the situation, an elderly non-patient refusing to leave the waiting area despite multiple requests, taking up space, being disruptive. They needed to escort him out. The security guards looked at Clint, looked at each other. One of them, a younger man named Marcus, recognized him. His eyes widened, but he didn't say anything yet. Sir, the other guard said professionally, we're going to need you to come with us. I'm not going anywhere, Clint said quietly. I'm here with my daughter who is in a car accident and has a possible concussion. I'm not causing a disturbance. I'm not taking up a bed or medical resources. I'm simply sitting in a chair waiting with my family. And I have every right to be here. Hospital policy, Carson started. Hospital policy, Clint interrupted, does not allow you to remove family members from the waiting room because they're elderly. Hospital policy does not allow you to discriminate against patients or their families based on age. And hospital policy certainly doesn't allow you to tell a 94-year-old man that he's too old to be worth treating or that he's a liability for simply existing in your waiting room. The waiting room was completely silent now. Everyone watching, everyone listening. Marcus, the security guard who'd recognized Clint, pulled out his phone, stepped away, made a call. When he came back, he looked at Nurse Carson and said, the director of nursing is on her way down. Carson's face changed. It's not necessary, I can handle. She's already on her way, Marcus said. And there was something in his voice, something that suggested he'd seen this before, had maybe heard complaints before, and was glad someone was finally doing something about it. The director of nursing arrived, and so did the hospital administrator. And the conversation that followed changed everything. Patricia Morrison, the director of nursing, arrived first. She was in her 60s, had been a nurse for 40 years, had 0 patience for discrimination of any kind. She looked at the scene, Clint standing calmly, Sarah standing protectively beside her father, Nurse Carson looking defensive, 2 security guards looking uncomfortable, and a waiting room full of witnesses. Someone tell me what's happening, Patricia said. Carson started talking, explained that this elderly non-patient was refusing to leave, was taking up space, was being disruptive, I'll tell you what's happening, Sarah interrupted. This nurse told my 94-year-old father that he's too old to be in this waiting room, that at his age there's only so much they can do anyway, that he's a liability, that he's wasting resources. And then she called security to remove him. Not because he was causing any problem, but because he's old.
Patricia's expression hardened. She turned to Carson. Is that accurate?
I was managing limited resources. Did you tell this man he was too old? That he was taking up space? That he was a liability? Carson hesitated. I may have suggested yes or no. A pause. Yes. The hospital administrator had arrived by then. Robert Chen, late 50s, had been with the hospital for 20 years. He'd heard enough of the conversation to understand what was happening, and he looked absolutely horrified. Jennifer, Patricia said quietly, go to my office. Now, we'll discuss this there. I was doing my job. Your job is to provide care, not to discriminate against people based on age. Your job is to treat all patients and their families with dignity and respect. Your job is not to decide who deserves space in our waiting room based on how old they are. Now, go to my office. You're suspended effective immediately pending investigation. Carson opened her mouth to argue, looked around at the witnesses, at the security guards who weren't going to back her up, at her supervisor who was furious, at Clint Eastwood, who she just realized was Clint Eastwood, and finally understood exactly how badly she'd miscalculated. She left. Patricia turned to Clint. Mr. Eastwood, I cannot apologize enough for what just happened. This is not who we are as an institution. This is not the standard of care we expect from our staff. I promise you this will be investigated thoroughly and appropriate action will be taken. I appreciate that, Clint said, but I'm less concerned about what happened to me than what's been happening to other elderly patients who don't have the resources or recognition to push back.
Patricia and Robert exchanged glances. Robert spoke. What do you mean?
What Clint said next opened an investigation that went far beyond one nurse.
That nurse has been doing this for a while, Clint said. The way she spoke to me wasn't improvised. It was practiced, comfortable, like she'd said those things many times before to other elderly patients, other families. And I'm willing to bet if you look at complaints, patient satisfaction scores, family concerns, you'll find a pattern. He turned to address the waiting room. How many of you have seen her treat elderly patients or family members dismissively, speak over them, minimize their concerns, suggest they're wasting resources or time? The silence was heavy. Then the elderly woman who'd been sitting with her son raised her hand. She told my mother last month that at 87 she shouldn't expect much from physical therapy, that she should just accept being in a wheelchair. But my mother wanted to walk again, and with a different therapist at a different facility she did. She's walking now. A middle-aged man spoke up. She told my father he was too old for a knee replacement, that he should just manage his pain. But we got a second opinion and another doctor did the surgery. He's pain-free now, playing with his grandchildren. More stories, more examples, more evidence of a pattern that had been going on for years. Right under the hospital's nose, right under supervisors who should have caught it, right under a system that should have protected its most vulnerable patients.
Robert Chen looked shaken. Patricia Morrison looked furious, not at being exposed, but at having failed to catch this sooner, at having let it happen on her watch.
We'll investigate, Robert said, thoroughly. And not just Nurse Carson. We'll review our policies, our training, our complaint procedures. We'll figure out how this was allowed to continue and ensure it never happens again. I want more than an investigation, Clint said, and his voice had the quiet authority that made people listen. I want policy changes. I want mandatory training on age discrimination for all staff. I want an independent review board for complaints involving elderly patients. I want regular audits to ensure elders aren't being dismissed or mistreated. And I want it implemented not just here, but system-wide. Because if it's happening here, it's happening at your other facilities too. He paused. And I want to fund it. All of it. Training programs, oversight systems, patient advocates specifically for elderly patients. Whatever it costs. Because no 94-year-old should be told they're too old to matter. No 87-year-old should be told to just accept being in a wheelchair. No elderly patient should be treated as disposable just because they've lived a long time. The waiting room was silent. Sarah was crying. Patricia Morrison looked like she was fighting tears. Robert Chen was nodding slowly, already mentally reorganizing priorities and budgets and policies. We accept, Robert said. And thank you for pushing back, for not just walking away, for caring about the patients who'll come after you. Jennifer Carson was fired 3 days later. The investigation revealed exactly what Clint had suspected, years of documented complaints that had been dismissed or minimized. Elderly patients who'd been told they were too old for treatments that other doctors later provided successfully. Families who'd raised concerns and been told they were overreacting. But more than one person lost their job. 2 supervisors who'd ignored complaints were dismissed. A hospital administrator who'd prioritized bed turnover over patient care was asked to resign. The entire system underwent review. And true to his word, Clint funded comprehensive changes, age discrimination training for all staff, an elder patient advocate office with authority to investigate complaints and override medical staff if necessary, regular audits of how elderly patients were treated, with results published publicly, a patient bill of rights specifically addressing age discrimination, anonymous reporting systems so staff could report concerning behavior without fear of retaliation, Within 6 months, the changes rolled out across all 15 hospitals in the system. Within a year, other hospital systems were adopting similar policies. Within 2 years, the state legislature passed a law requiring all healthcare facilities receiving state funding to have elder patient protections in place, all because a nurse told a 94-year-old man he was too old to be in a waiting room. All because that 94-year-old man refused to accept that answer. All because witnesses spoke up. All because administrators listened. Sarah's concussion healed fine. She was monitored for a few hours and released with instructions to rest. Clint stayed with her the entire time. In the waiting room, he'd been told to leave. In the chair, he'd been told he was wasting. The elderly woman whose mother had been told to accept a wheelchair? She wrote Clint a letter thanking him. Her mother walked down the aisle at her granddaughter's wedding 6 months later. The middle-aged man whose father had been denied a knee replacement? His father sent Clint a photo of himself hiking with his grandchildren, pain-free, active, living. Other letters came from elderly patients who'd been made to feel like burdens and now felt valued, from families who'd been dismissed and now felt heard, from nurses and doctors who'd seen concerning behavior but hadn't known how to report it, and now had systems in place to protect patients. Clint didn't keep the letters. He sent them to the hospital, posted them in the elder patient advocate office. Visible reminders of why the changes mattered, why protecting elderly patients' dignity wasn't just good policy, it was moral imperative. 5 minutes. That's how long it took from Nurse Carson calling security to the director of nursing arriving and suspending her. 5 minutes from attempted age discrimination to career-ending consequences. 5 minutes that changed healthcare policy for thousands of elderly patients across an entire state. People sometimes ask Clint why he didn't just leave, why he made such a big deal about a nurse being rude, why he pushed so hard for systemic change instead of just accepting an apology and moving on. He tells him about the elderly woman who'd been told to accept a wheelchair and now walks, about the father who'd been told he was too old for knee surgery and now hikes with grandchildren, about all the elderly patients who'd been dismissed, minimized, told they were too old to matter, too old to be worth the effort, too old to deserve dignity. I didn't do it for me, he says. I did it for every 94-year-old who comes after me, every 87-year-old, every elderly patient who deserves to be treated like a person, not a problem, who deserves dignity, not dismissal, who deserves care, not contempt. At 94, Clint Eastwood had been told he was too old to be in a hospital waiting room, too old to matter, too old to be worth the space he occupied. And his response, calm, measured, uncompromising, had protected thousands of elderly patients who would never know his name but would benefit from the changes he'd demanded. 5 minutes from discrimination to firing, but a lifetime of impact for patients who came after. That's what happens when you underestimate someone because of their age, when you assume elderly means disposable, when you forget that every old person was once young, has lived a full life, has people who love them, and deserves basic human dignity.
Nurse Jennifer Carson learned that lesson the hard way. And thanks to the changes that followed her firing, thousands of healthcare workers learned it too. Not through punishment, but through training, through policies, through systems designed to protect the most vulnerable.
All because one nurse told one elderly man he was too old to be in her waiting room. And that elderly man had the courage, resources, and determination to say, no, I'm not too old to matter. And neither is anyone else. Don't forget to subscribe to the channel and turn on notifications for new stories.